Everyone, it's Chris in the North Conway studio with another very special guest, this time all the way from Androscoggin Valley Hospital. It is Dr. Shannon Frye, who is an audiologist. Thanks for joining us today, Dr. Frye.
Thank you. Thank you for having me today, Chris.
And we love these stories of local people who have gone on, studied, and come back to offer their services here in the White Mountains. And that is kind of your story. I believe you're a Berlin native, and now you're back in the area. We're going to get to that in a little bit, but first, tell us a little bit about audiology. What is an audiologist? What's a day in the life of an audiologist like?
Absolutely. So what I love about being an audiologist is the variation in what I do day to day. An audiologist is a professional that treats and diagnoses hearing and balance disorders. So on a day-to-day basis, you may find me performing hearing tests or audiograms. I work directly with the ears, nose, and throat team here at AVH. So working with patients who have sudden hearing losses, ringing in the ears or tinnitus, as well as vertigo and dizziness. We do perform dizziness and balance testing here called the BNG test, as well as additional hearing aid services as well. So personalized hearing aid consultation services, hearing aid fittings, as well as troubleshooting hearing aids. So it's a really nice balance between patient care, diagnostic testing, and a vast amount of technology.
And when should someone get their hearing tested? I know a lot of people will wait until they are sure they have a problem. There's always kind of that time frame where you're not sure if maybe your hearing's going a little bit. Should I have it checked? Should you wait until you know you have a problem, or is it something you should do regularly?
It's a great question. So a lot of adults that I see in the clinic, the last time that they remember having a hearing test was in grade school. So it is recommended that sometime in adulthood that you do have a baseline hearing test so that we can compare in the future that result to your baseline test. Johns Hopkins Medicine actually came out with the most common symptoms of age-related hearing loss. And these include things like individuals sounding as though they're mumbled or slurred speech, having difficulty to hear conversations in background noise. People may have ringing in one or both of their ears. And last but certainly not least, individuals or their family members may notice that they're having difficulty to hear the television and the telephone. So if this sounds like a family member or yourself, it's always good to talk to your primary care provider about this and be scheduled for that baseline audiogram.
That's fantastic. So if you are experiencing any of those symptoms, or even if it seems if you have any questions, don't diagnose yourself. Get your hearing checked by a professional like Dr. Shannon Frye, audiologist we're speaking with at Androscoggin Valley Hospital. How has COVID-19 affected you? Obviously, it's a little bit harder to do inpatient stuff, or at least it was at the beginning. What's your schedule like now? How have patients been impacted because of the pandemic?
Absolutely. So now more than ever, I am seeing patients come into the clinic and they're having difficulty to hear people who are wearing masks. They may have had difficulty before, but what really drives them to come in and seek help is having difficulty to hear friends, family members, and even healthcare providers who are wearing masks. We know by now that it is the CDC's recommendation for masking and social distancing. But as we've learned actually through a recent study, there's a reason why we're having more difficulty hearing with the masks. And this study was released in the Hearing Journal, and it tells us that the speech signal is actually being reduced by the masks quite a bit or significantly. So both surgical and N95 style masks. So if you are listening to someone who is 6 feet away with a mask, this is like listening to someone without a mask at 12 feet away.
Wow.
So in short, that combination between that degraded speech signal the distance that we are from others, and that loss of that visual cue that people rely on, this actually makes speech unintelligible for many people. So I think it's important now more than ever to check in with people to make sure that they're understanding what you're saying and to speak slowly and clearly. Folks.
Yeah, and if you were having hearing problems before and were able to compensate by reading physical cues from people, that's gone away now. So even more reason to really make sure your hearing is at its peak and you are as healthy in that department as you can be. One of the things that we love is when, homegrown talent comes back to the area, and that's your case. You grew up in Coos County and in Berlin, New Hampshire, and now back at Androscoggin Valley Hospital. Tell me what that's been like.
Absolutely. So I'm born and raised in Coos County. I attended Berlin High School. A lot of my patients remind me of those days where they would see me in the newspaper for my 3-sport athlete career. I was a track and field athlete at Berlin High. I did have a state championship and still hold 3 school records.
Wow.
So I actually received an athletic scholarship to go off to the University of Maine, and I ran 12 seasons for the Black Bears. I added cross country and indoor track to my repertoire. But I did graduate with a degree in communication sciences and disorders, and I was able to go off to the University of Massachusetts in Amherst for my Doctor of Audiology degree. As part of this program, there is a year-long residency involved with this, and I was able to have the opportunity to come back to AVH for this residency. And following this, I was offered full-time employment as a provider here, and I was more than thrilled to come back to my roots and to serve the North Country for their hearing health care.
It's got to be such a great feeling to have so many people following you throughout your educational career and sports career as a youth, and now to be able to give back to that community in the way that you are now. So congratulations and thank you for that. And what other services do you offer in audiology at Androscoggin Valley Hospital?
Absolutely. So an increasingly popular service is custom hearing protection. We do offer this service. We've seen a lot of hunters, marksmen, people who work full-time in noisy environments seeking this service. And we do offer the solid earplugs as well as custom electronic earplugs as well. This custom electronic plug does offer some amplification, and then it does shut off when it's presented with a high level of noise. So it's definitely been a service that a lot of people have been seeking. And if people are interested in that, they're more than welcome to schedule an appointment at the clinic for custom hearing protection.
That's fantastic. All right, it's time to make an appointment. How do people do that, and where do they find you?
Absolutely. So we are available at a few different locations now. Starting in February 2021, we have expanded to Weeks Medical Center in Lancaster. My medical assistant and Mandy, is going to be joining me at Upper Connecticut Valley Hospital in Colebrook as well, a few days a week. And then we're full-time here in Berlin at Androscoggin Valley Hospital.
All right, thank you so much. We've been talking with Dr. Shannon Frye, Androscoggin Valley Hospital Audiology. Anything else you want to say before we say goodbye?
Yeah, I just want to thank the community, my family, for their support over the years. It's great to be back in the North Country, and I'm looking forward to seeing everyone.
All right, well, it's great to have audiology in the North Country as well. Thank you so much, and we will talk to you soon.
Thank you very much.
All right, you're watching White Mountains TV.